I'm in the middle of nowhere, Wyoming, charging. So I figured I might as well make some content. So I want to talk about our purpose, what we should be doing, what we're actually doing, and if that actually makes sense, and who we actually work for. So this came up in day 2 of the 3-day challenge, where I think it was Shelby was talking about how she was practicing doing the screen that we talked about in day 1, and had I think it was a patient that was coming in for a shoulder issue, but noticed that this patient's gait was atrocious. So I said, okay, so here is your conundrum as a clinician. You get, and let's say this is a Medicare patient. So I'm going to relate this to a Medicare patient that I'm seeing. So Medicare patient is referred to you, and you know that if a Medicare patient is referred to you for diagnosis such and such, you're only supposed to treat that body part for diagnosis such and such. Now, I'm going to shoot a follow-up to this about how asinine it is that we're getting patients coming in that were diagnosed with something by a physician or a previous PT, chiropractor, whatever. That is idiotic. We'll talk about that in the next video. But this patient is coming in, and she was given a diagnosis by her physician of vertigo. And the reason why she was given this diagnosis of vertigo is because she's been having problems with falls at home. So, patient is walking back to the treatment area, and I'm taking her back from the waiting room. And I noticed that her gait is atrocious, okay? She's using a cane, still almost falling over. I mean, her feet aren't moving. Her knees are buckling. She's unstable. She's swaying back and forth, loss of balance. So we get her back to the treatment room, have her sit down, and ask her, my question to everybody when they come back and sit down is, so tell me what's going on. And she says, well, I have vertigo. And I said, okay, tell me about that. And she said, well, I fell and I hurt my knee a couple, like 2 or 3 weeks ago. So I went to the doctor and they said I have vertigo and I'm coming to physical therapy for vertigo. And I said, okay. And on her intake, she had listed that she had a total knee done a year or 2 ago. And so I said, well, I noticed when you were walking back here that you're a little unstable and saw that you had a total knee done. Tell me about that. She says, oh yeah, my legs aren't very good and my balance isn't very good, but it's because of my vertigo. And I said, okay, so when you fell, did you fall because you got dizzy and kind of like lost your balance and fell there? Or did you fall for some other reason? And she said, oh, I fell, I'm pretty sure my legs gave out because, you know, my legs are weak. And I said, okay, so you had this total knee done. Have you had any other leg issues? And she said, well, yeah, I had my other knee done a couple of years before that. And I said, okay. And I said, anything else, like feet, legs wise? And of course, she's got her typical Medicare 5-inch Hoka rocker bottom cushion shoe because somebody else who's a genius told her that you need to have more cushion in your shoes. And she said, oh yeah, well, my ankles are fused. Could that be why she's losing her balance? And could that be why she's falling down? And maybe, just maybe, she doesn't have vertigo. Well, let's keep going down the road. So I said, so what's going on with your ankles? She said, oh, they've been terrible forever and they've basically fused themselves so they don't really move anymore. And I have really bad feet, so that's why I have to wear really good shoes. Okay, so I said, so tell me more about like when you lose your balance and do you get dizzy? Does it feel like the room is spinning? Is this like when you roll over in bed or go from standing up to laying down? Does it feel like you get nauseous? And she says, oh no, never had that problem. I said, okay, so why do you think you have vertigo? And she said, well, because my doctor said I have vertigo. That's why I fell down and I need to go to physical therapy for vertigo. And I said, so what did your doctor do to diagnose you with vertigo? Did he do some tests and the room started to spin and that's how he figured out that you had vertigo? And she said, no, I just told him that I fell down. Now, here is your conundrum. She was given a script that says go to physical therapy for vertigo. You know that Medicare is going to dictate that you use the physician referral diagnosis as your treating diagnosis, and you are to treat that, and you are to treat that only. So for me, as the clinician, to go out of my bounds, out of my realm of being a doctor of physical therapy, and treat her for what her problem is, which is instability, weakness, lack of range of motion throughout her lower extremities and her trunk, which would give her a much better chance of decreasing falls than treating her for vertigo, which she doesn't have. So what are you going to do as the treating clinician? Here's what I did. I did a little provocative maneuver with her. She didn't get dizzy, and I said, guess what? If you had vertigo, you would be dizzy and you would be nauseous. You don't have vertigo. Your problem is your ankles don't move. Your knee, your legs, the muscles that stabilize your knees are not strong. Your balance is, your center of gravity is all over the place outside of the base of support that you have, and that's why you have this cane. And even with the cane, you still have terrible balance. So I didn't say it like that, but basically I told her, your balance sucks, your lower extremities strength sucks, and your ankle range of motion, we got to figure out if there's any chance of getting more of that, because that's what your problem is. So my purpose as a doctor of physical therapy is to get to my patient's root cause of their problem and address that and get them to be able to function as best they can. So with this patient, we worked on first going through and facilitating neuromuscular function throughout the lower extremities, which was absolutely atrocious all over the place, getting her trunk stability better, giving her exercises for strengthening and maintaining facilitation at home, and educating her that she's got to get rid of these damn Hoka shoes. Like, I had her walk, so I wanted her to understand how bad her balance is and how the Hokas are actually making it worse. So I had her get back up and walk one more time and say, okay, remember what that feels like and how much you're losing your balance and how much you're using your cane. Let's take your shoes off and see what happens. Oh, I can't do that. I've got plantar fasciitis too. So somewhere along the line, some other genius told her that she has plantar fasciitis. So I said, well, stick with me, try this out. Take the shoes off, have her walk with her cane, and her trunk sway basically disappeared. Her loss of balance disappeared. She was still using the cane, but I asked her, now, how do you feel now, stability and strength-wise, versus when you were walking with those shoes on? And she said, I'm actually more stable now. And I said, exactly. Those shoes have so much cushion and this rocker bottom that your foot is never stable. So you've got all of these problems with what's going on from your feet to your ankles to your knees to your hips to your back. And you're trying to walk on a moving surface that never gives you a rigid base of support. So if we get rid of these stupid shoes that you have on, we're already going to decrease the risk of you falling down again. So we got rid of the Hokas. I said, find your flattest, most flexible shoe that like shoe that moves, because here's the other problem. You're in these rocker bottom shoes where your foot's not moving. You're just rocking back and forth with the motion of the shoe. So I know you're wondering about this ankle fusion thing. So she's really has no ankle motion. Okay, so we're gonna have to figure out how to help her compensate up the chain to figure out how that works. But just getting rid of the Hokas, just getting this garbage out of her head about I have vertigo, and then working on facilitation and strength to increase stability is the only chance that we have to keep her from falling down. So I'm not going to treat her for vertigo. That's not my job. I don't work for Medicare, and I don't work for physicians, especially physicians that are too stupid and lazy to actually assess their patients before they give them a bogus diagnosis that just totally mind screws the patient. Okay, so ask yourself who you work for, what your purpose is, and if either one of those things is to work for your patient, to do what's best for your patient, then you need to quit worrying about what the insurance company says, even if you're in an insurance-based clinic.